Today let's talk about winters and headaches, and why are some headaches common in winter, because then winter in itself becomes a headache. So what happens in winters, there are 2 or 3 types of headaches that can have increased frequency or severity, or they can come up only during winter. So one is that the patient has headaches in the background. For example, he or she is suffering from migraine, and then the migraine got exacerbated during the winters. The second is the patient doesn't have any headache in the history in the background, and he or she only has headache during winters. And the third, then there are certain headaches which are more common during winter than the other seasons of the year. So coming on to what happens in the winter which causes these headaches from occurring. So let's first cover migraine. So migraine in some patients become more common during winters. Now migraine, because it's an hormonal headache and it's because of certain neurotransmitters and oversensitivity of your scalp and pain sensitive structures of the brain, what happens is there are certain triggers for the migraine, and some of those triggers come during the winters. Now what happens during winters is, during winters the sunlight, the duration of that goes down, and with the result our circadian rhythm, which is in part controlled by these hormones, which sunlight is partially controlling the factor. So what happens is, during less sunlight exposure, the circadian rhythm goes for a toss and it changes. With the result, the change in routine can cause the headaches to appear. Along with that, the duration of the sunlight is also important for our mood. So for example, if the patient has less exposure to sunlight and because of that he or she feels low or depressed, then it may cause secondary headache also. Along with that, winters in itself brings with it dry air and cold air. Now some people have insensitivity to the cold exposure, especially to their scalp. So whenever they get cold exposure to their scalp, they start having headaches because they are intolerant of it. Thirdly, what happens is, winters we start drinking more hot fluids such as soups, coffee. Some patients are intolerant to coffee. For some migraine patients, coffee can be a treatment, but for others, coffee can be a precipitating factor or a stimulant for the headache attack. With soup, what happens is that there is a certain preservative known as monosodium gluconate, which is in itself is a trigger for migraine and can cause migraine attack to precipitate. Along with that, during winters, we drink less water, and because of that dehydration happens, and dehydration in itself can cause migraine attacks, or dehydration can also cause primary headaches as well. Now apart from this, what other things happen during winters? One is we have heaters or blowers running in our room, which also cause the dry air. We sleep early, we wake up late, or we wake up early. So what happens is our sleep cycle, our routine, it goes completely out of turn, and it can precipitate headache. Along with that, winter in itself brings a lot of pollens, a lot of allergens, and nowadays pollution. So what these things do, allergens, pollens, pollution, what it does is it kind of gets you allergic, especially your sinuses, your nasal mucosa, your sinus mucosa. If it is allergic, you kind of had an allergic rhinitis, rhinosinusitis, which can cause secondary headache. So the third thing which happens during winters is, there are certain headaches which are especially common during winters. They occur only certain part of the season, and they are sensitive to certain temperatures, and one of which is cluster headache. Now these patients, they tend to have headaches only during winters because cluster headache has been found to be temperature sensitive. They are fine all throughout the year, but they have headaches during winters. So as I told you, migraine can get precipitated by the winter because of many of these factors. Cluster headaches and other types of headache can come during winter. And then there are secondary headaches such as sinusitis, headache due to depression, sleep changes, they can also come during winters. Now, what we can do to prevent these headaches and how we can avoid going to doctors and taking medications. So first of all, change in your lifestyle, especially your sleep-wake cycle and your diet. So as I said, that the sleep cycle changes, so you need to make sure that you have a proper sleep routine. Along with that, you have a proper sunlight exposure. It becomes difficult for those who work in the offices which have less sunlight exposure. So what you can do is, after your lunch, go out, take a small walk for 5 to 10 minutes and have good adequate sunlight exposure. If you are sensitive to dry air, avoid using blowers in the room as heaters, use oil heaters, and then along with that, avoid going outside when it is too windy. If your scalp is too sensitive to the cold air, wear caps or masks. Then if you are allergic to certain pollen or pollution, obviously you should go out wearing a mask and avoid outside exposure if possible. So if you do these all lifestyle and your dietary modifications, you can in a lot of way, in a great proportion, can control your headaches from coming and can also avoid visit to hospitals or getting an exacerbation.